The most powerful thing that I do for my clients on our first intro coaching call of their GLP-1 lasting weight loss journey is establish whether or not they need to do a reset or a reverse diet for their weight loss plateaus. Here's the kicker, guys. Weight loss plateaus are not always easy to see. It's super obvious when you were losing weight and you stopped losing weight and you didn't just have a plausible explanation, right? You didn't start eating more and exercising less, you just stopped losing weight. We know that's a weight loss plateau. But where it gets tricky are the hidden ones, and there's many examples, but here's one I'll tell you right now. I didn't realize for the last 3 years I've been significantly under eating. Again, whether or not you're on GLP-1 medication. So I wanted to show you guys a clip from one of our recent trainings we had a lot of requests for people in our community because they get to see the recordings, and so I wanted to share a clip with you guys. Enjoy. Okay, so let's start with Tracy.
Yeah.
Hey. Hello. I like your back. Where in the world are you with that background?
I'm in Dallas.
Okay.
In my home, in my apartment in Dallas.
Awesome.
Yeah.
Let's see. You had a consult with me last year. Oh, super cool.
I did. And then I spoke with you again. Yeah, my daughter was starting the Ozempic. She's done great. I want to get her connected with you too, but I'm not on the injectables. I'm just on the AOD.
Yeah.
I'm just trying to lose about 10 pounds. I'm probably that would be overkill for me. And I followed you for a long time. I have a couple of things. I don't know how to figure what my caloric intake should be. I probably am under eating because, and this is my big question is, I fast almost every day. Like I'm not hungry. I get up in the morning. I don't really eat. I have coffee and then I have one meal a day. So I eat between 4 and 8 and I do that every day. And I think I am at a plateau because I'm like for the past 2 years, I put on 10 pounds and I'm doing consistently the same thing.
Yep.
So I don't know how I should be fasting every day.
Totally.
How do I do this?
Yeah, no, this is great. And believe it or not, guys, there's a lot to learn from this situation too, because the fundamental rules apply to the body as far as resets and metabolisms, regardless of whether you're on GLP-1s or not. I would agree you probably are under eating, which is the reason I don't recommend the 1 meal a day, even though in theory, that's a lot of fasting. And as long as you're getting enough calories with the 1 meal a day,
I don't think
it would work great. But that's the thing. When you're eating 1 meal a day, unless you're counting that meal, which most people don't, you're probably under eating. Your pulse on it is probably correct. So we need to do a reset. If you had to guess, how many calories do you think you're getting on average?
I probably eat between 900 to 1200 a day.
Yeah, which is really low. So let's start you off on week number 1 at 1200.
Okay.
And what we're going to do is week by week, we're going to work with you and bump you up about 250-ish. And based off of what you're telling us, we look for confirmation that your body's metabolism is speeding up, and then we're going to keep bumping you up. This might sound scary, but I want to get you as high as we possibly can.
Should I be eating breakfast, lunch, and dinner then with that?
Great question. So in theory, if you could still be fasting, that would be amazing. But the point of the reset is to speed up the metabolism. On medications or not, getting the calories in is priority number 1. So that means if you have to increase your eating window to do that, then so be it, because that's the priority.
Okay.
Also, for all of you guys, no long fasting, meaning more than a day, during the reset. I'm okay if you do an 8-hour eating window, that's fine, or 10-hour, whatever it takes to get the calories in, but you got to be getting your calories in every single day during the reset.
Okay.
Cool. AOD is awesome. We'll talk about AOD and GLP-1 after we go through all 5.
Should I still be taking that along with should I hold off on that?
I'm going to get into that after I go through it. Yep. Fantastic. Any other starting point questions for you, Tracy?
No, I guess once I get to where I should be, what should my caloric intake be? Like that normal thing you talk about. I haven't been able to really figure that.
Yeah. What's interesting is as much as we have these calculators, the reset's actually going to tell us how high you should be. So
okay.
1800, I'm guessing somewhere 18, 19, your activity level is obviously going to vary. So we're going to get that number as high as we can. And that's going to tell us, let's just say we get you to 2000 and you're like, oh my gosh, I can't believe I'm eating this much, but I'm not.
I've never eaten that much.
We'll see what it is, but you'll be feeling better. You're not gaining weight. That's the goal. So let's just say it's 2000. With this protocol, once we start after the reset, we're not actually trying to decrease the intake. No, we're trying to increase that weekly long fast. And so it's a completely different way of thinking about our calories. We're trying to get the maximal fast, but then we cycle around the fast with higher eating days. And so that's how we prevent that plateau that everybody finds themselves in.
Okay.
Fantastic. Okay, great. Thank you for wanting to bring your daughter to me. I really
Yeah.
appreciate that. Lua, we got, let's see. So we're doing tirzepatide, AOD, just completed 4 weeks, and you went up from 4 milligrams to 5 milligrams of tirzepatide, correct?
That's correct.
Okay, fantastic. Tried sema last year, but it wasn't as effective for you. You have already lost 20 pounds in the last month. In 1 month or a little bit more than a month?
In 1 month.
That's pretty fast. Okay.
Yeah.
Let's see. Always, guys, a good range of weight loss, 1 to 1.5% of body weight per week. At any point, if you start seeing yourself losing more than 1.5%, that's too fast. And so, let us know. It's a good metric. We need to increase your eating. We need to slow it down. Just, you might be thinking, why would I want to slow it down? We want to prevent skin elasticity issues. We also tend to see that if you're losing too fast, it might be that you're losing too much muscle mass. And so just those 2 reasons alone, it's good to try to give you an idea of range. Truthfully, because we're not able to do scans, it's hard to know. So you have to be considering the other factors, scanning meaning body fat versus muscle. So the other factors come in. Have you been weight training, Lua?
I have been. I also, when I started, was extremely inflamed. My feet were just balloons, my ankles, and now I can see all the bones in my feet and my ankles, and I don't have the joint pain that I was having.
Good.
And I am actually now totally pain-free, where I could barely walk before I started.
No, that's fantastic. And I've seen these kind of miraculous things happen with GLP-1s. And my goal with you is going to be to continue to improve the body as much as we can with lifestyle. So that way we don't have to keep cranking up the medication dose. Okay, fantastic. Let me ask you, last 2 weeks, if you had to guess how many calories you think you're averaging?
So I had been doing 1,200 until I found you. And I'm watching all your videos. And so I was like, okay, I need to, and I was doing 100, my goal was 100 grams of protein and 1,200 calories. And so I say, because I got my wisdom teeth out this last week. So this last week has been a different week. I'm on all pureed foods, and I've not hit, I've been eating about 800 calories and maybe 30 grams of protein if I'm lucky.
Okay.
But I'm just giving myself the time to heal my mouth. But the week before, so I have been trying to up it to get to the 1,800 calories. And then I was thinking, I don't know, 150 grams of protein, but that was just a guess from what I've seen from your videos.
We'll talk about protein when we get into food. Let's start with 1,600 and let's establish 1,600 as soon as you can, obviously, with the recovery. Yeah. And I wouldn't call this a reset as much as it is just maybe a preventative reset, because the last week or 2 you've been losing, correct?
Correct.
Okay. So
I'm down another 5 pounds. So I'm down total 25 pounds.
And are you eating 7 days a week, or are you doing long fasting already?
My sister Anissa, who's also on this call, we are doing this together. We started the fasting 2 weeks ago.
Okay. So
the first one was hell. The second one was breeze.
Yeah.
And I've done, like, for a long time, intermittent fasting, but I'd never done prolonged fasting before. So that was brand new to me. And it was really fascinating what my body did that first week. And it was literally the day after I had came off that fast, I found your video about the physical symptoms of prolonged fasting when you just start. And I was like, oh my God, that's what happened to me. It was like to the T. I was like, okay, then I was like, maybe I'm hypoglycemic. Maybe I'm going to pass out. I don't know if I was going to pass out, shit my pants, or barf. Like, I was like all 3 things all at the same time.
That's funny.
Yeah. But this last time it was much better.
Good. So just to get us through, let's do this. We'll do 1,600 and then we'll probably bump you up one more time. Let's eat every day for the next 2 weeks, just because I want to really finish off the reset, get your metabolism as fast as we can, and then we'll crank you right back into the flow fasting.
Okay. Okay. Sounds good.
Fantastic. All right. We got Princess. Where's Princess at? Hello, hello. All
Hi,
right.
how are you?
Good. Do you prefer being called Princess? That's what I see here. I just want to make sure.
It's my name, like on my birth certificate.
Oh, cool.
She is
cool,
a
cool.
princess.
I was like, that's an awesome name. Okay, cool.
Yeah.
All right. So looking like we're doing AOD only. Okay.
I'm on tirzepatide, but I use another company
Totally. Okay, good. So you're
yeah,
on tirzepatide. Fantastic. Okay. How many weeks have you been on tirzepatide already?
since December of last year. So for 8 months. So I watched your live and I think I made a few comments about it not working for me.
Wow.
So I'm on the max dose of 15 milligrams and I also have PCOS.
Okay.
So I don't know if my hormonal condition is what's causing this, but this whole time I maybe lost like 12 pounds.
Yeah.
I'm frustrated.
For sure.
Yes.
Just so you know, PCOS in most cases, while it is the problem, the hormones, male androgen hormones, all the stuff they're doing to you, there really are downstream of the same problem that everyone else is going through. It's just you have it worse with PCOS, insulin resistance. So that's just so you know, like you put your attention on fixing insulin resistance, and the downstream effect will be the hormone profile will improve. So as crazy as that sounds, so we just gotta. That's what we got in front of us, and the principles of flow are very much effective for fixing insulin resistance. It's just in your case, you might have to be even more strict.
Oh, yeah.
How long? Okay, so how long have you been on the max dose for?
I think 3 weeks now, so not super long.
Okay. How do you feel as far as like your eating and hunger and all that kind of stuff?
It's the same. I don't think being on like a higher dose affects me differently than 5 milligram or 10 milligram. But I was speaking to my doctor who prescribed it, and he actually prescribed me naltrexone, I believe that's how you say it, 50 milligrams, but I'm only taking 25 milligrams.
Yeah.
It's been helping a little bit with the sugar cravings and all that. So yeah.
So this is gonna be a journey for you where you'll have to make a decision as far as these first couple weeks, whether you want to, and there's no right way or wrong way, especially because I can't tell you what to do on with regard to the dosing. I can educate you as much as I possibly can, and I can help you along your journey, right? Staying on the medications that you're on and then just continuing with the protocol, or trying to reduce and see what that does while doing the protocol. They're they both have different use cases, right? So the trying to decrease the dose means, like you said yourself, you didn't notice much of a change when you increased anyways. So taking a higher dose when you didn't notice anything only has potential for negativity, right? Because now you're becoming desensitized to the medication. You're slamming those receptors really hard. When there could be another roadblock why you didn't feel it, why you didn't feel the medications. And so lowering it could be a chance to, while focusing on the rest of the protocol, see what happens and then possibly increase later, even if we need to or not. So that's one aspect, with the caveat of decreasing might have a negative impact, where maybe you start gaining weight, maybe you're not happy with how you feel, and now you have to move backwards. Not the end of the world for the potential benefit, but because it's like a little bit of a risk with the reward, you're going to have to make that decision. Just let us know what you want to do, and just so we're aware of what path you want to go with that. And you don't need to give me an answer right now. You could talk to your doctor or whatever you want to do and let us know. If it were me, I would always try to see how my body can do off of a lower dose, just because of, obviously, I have a understanding of what the potential for the lifestyle can do. But of course, your body's going to react the way that your body is going to react. So we'll just, any questions on that decision you need to make?
I actually prefer that. I tried a lower dose this week and it was literally the same. I think it was like 7.5 milligrams that I tried this week and the same as 15. So I'm okay with that.
Yeah, no, I think if you feel stable, keep going down. If you notice there's really no change, weight's not changing, hunger isn't going crazy, you might as well keep going as low as you can. So I like that plan. I like that plan. So Ceci will document that. Do you happen to know how many calories you think you've been averaging?
Like between 16 and 19. 1,000 a day.
So between 16 and 1,800 calories a day. So that's not too bad. Activity level, would you say it's pretty high, moderate, low?
I would say moderate, just with my schedule right now. I'm trying to do more with the exercising. That's something I have to get on. I like lack a lot, but I would say moderate.
Yeah, and we're gonna talk about that's how we're gonna end today's call with is just the resistance training. It's so vitally important we get that in more so than any other exercise, and we'll talk more about that later. I think let's start you off at 1,800 calories. Again, if I'm going to call this a reset, it's going to be short. I just want to see how high we can get your caloric intake. So let's put you at 1,800 and that might be it. If you do good and your weight doesn't increase, we might try 2,000 just to see, and then we'll go from there.
Okay.
Fantastic. Okay. Let's see. Shireen. Shireen, did I say that right?
Yes.
Fantastic. Okay. I see that you were, hello, nice to meet you. All right. You were on semaglutide for 2 months, lost 12 pounds, but the weight came back with a vengeance, you say. I know. Was it right when you stopped the medication or a couple weeks afterwards?
No, it took a few months to come back, but it just kept going. It feels like I'm just increasing weight. Yeah.
And when you lost that weight at that time, were you doing resistance training or you look back and go, no, I could have been lifting weights more better, eating higher protein?
I think I had extreme hunger, and then I did lift and I was walking. I was pretty active.
Okay.
So I continue to, but it just feels like it's nice. It feels like it's my new baseline.
Tirzepatide is different, so I think you'll like that better. So calories wise, what do you think you've been averaging?
So I just came back these past 2 weeks. I've been really trying to focus on diet, and I've been trying to do keto, and I'm on semaglutide right now. But my average calories is probably about 16, sometimes 1,200, sometimes 1,600.
Okay.
Focusing on protein and vegetables, but that's it.
If we are going to go keto, which is what I recommend for the first couple of months of this healing program, we want to understand, and we'll talk more about this, but we are replacing carbs with healthy fats. And so I just want to be clear, when I hear someone say protein and vegetables, my concern is the calories are too low. Now, because you can only eat so much protein, right? So the carbs, there's only 3 options, right? Carbs, protein, fats. Vegetables are basically just fiber and a low amount of them. Definitely make sure we're getting in some nutritious types of fat so that we are hitting our calorie goals. I think your intake's a little bit low. So let's also put you on a reset. Let's start you off at 1,600 just so that you make sure that you're at 16, and then we're going to keep bumping it up from there to get that metabolism as fast as we can.
Okay, so I know that you've talked about cortisol levels and hormone levels. I tend to be very low in DHEA, and my cortisol levels are low and then they get high, which is an oxymoron, but they tend to do both. And generally my hormones run low, just with chronic stress in the past.
Are you on BHRT therapy, on hormone therapy, or no?
I am. Yeah.
How long have you been on BHRT?
It's been years.
Okay. And even so, I guess when you say you're low, they're unable to get your levels to an optimal level. Is that what you're saying?
They continuously tend to be low, even though I'm on estradiol and progesterone. Progesterone's okay, but estradiol tends to be low, even with therapy. Yeah.
Interesting. And they don't have any theory as to why you can't seem to get your levels to where they want to get it to?
If you're watching these clips from my coaching calls and wishing you can be part of the team, I'll put a link in the description, but we have thousands of individuals who are kicking ass using microdose intermittent use protocols and implementing sustainable lifestyle strategies, guys. Click that link, fill out your information. Now, back to the show.
No, I think my issue is my doctor, because she had me on progesterone continuously instead of the last 10 days of my cycle. And I think that's what caused a little bit of insulin resistance. But I figured I had to do it on my own, where I'm like, okay, I'm just going to try the last 10 days of my cycle, or before my cycle. So yeah, I don't understand what's going on, but I think the issue is my doctor.
The good news is, and I've seen, like we were talking about with the case of PCOS, the sex hormones really are secondary to inflammation and insulin resistance. And so I know that's like exactly how we'll see how your body responds, but dropping body fat, improving insulin resistance should help. And that might be the ticket to your hormones actually elevating and your body responding. Inflammation can really muck up those receptors for the hormones too as well. So hopefully you get that straightened out with them, and we'll just continue to help you obviously with this, what we're doing, which is dropping body fat and improving your health.
I don't know if you've read in my history or not, but I've had a series of yo dieting, of extreme dieting. So weight loss resistance is very real with me. I know I lost on semaglutide last year, but it just, I don't know, my baseline just keep going to that baseline of
the weight set, it's like your body just wants to immediately go back. And so it's actually good news that you lost on GLP-1. It's especially semaglutide. So my confidence is high. Because you've already lost on the GLP-1. So we just need to now get in a base of powerful lifestyle, which is what we're doing. The fasting is the main one, but there's the other pieces too as well. And we're going to be here. We're going to be here to make sure as you hit your goal and you're stable and that you slowly start to wean off. And guys, you don't have to wean off right away. That's your choice, right? On what you want to do. I've gotten a lot more comfortable now with people migrating towards microdosing and intermittent use protocols, finding your comfort level. Obviously, a decision based off of how you feel towards the medications and your financial situation and where your body's at. Some people, I think, and I say this in my videos too, not 100% of people are going to be able to hit their weight loss goal and wean off. I think that's unrealistic. I think that many people don't even get this chance to do what we're doing, but somewhere in there, and we're going to help push you guys in that direction and support you as aggressively or non-aggressively as you want. Because, we're working around your life and your stress levels and where you're at. Okay, cool.
So should I not be taking semaglutide right now?
So I got one more person I'm going to go through. And then what I'm going to do is I'm going to talk to you guys as a whole about GLP-1 and AOD during the reset.
Okay.
Fantastic. And then we're going to brush through fasting and food too as well. So.
Okay.
Fantastic. Okay. Anissa. All right.
Hi.
Hey, so we got taking tirzepatide, looking to enhance the process, and you're with your sister, right? Is that correct?
Yeah.
Fantastic. Super cool. You're already on 50 units, so 5 milligrams, I'm assuming, yeah?
Yes, that's right.
Fantastic. Okay, good. Same question for you. How many calories do you think you've been averaging?
So I get between 12 and 1500 currently.
Okay, so I bet you know what I'm going to say next. We definitely, we got to bump that up. So let's start.
That's tripping challenging, but I'm working on it.
And this is where sometimes a lower dose needs to happen. I've had patients literally like that's the only way they can finish the reset was lowering their dose because they just couldn't eat. So obviously, if that's what you guys are running into, let us know. But many times that's not required necessarily per se, but we're going to talk about that here in a second. So let's start you off at 1500.
Okay.
And then we'll just keep working with you week by week to get you through that. Okay. AOD during the reset is an awesome peptide. It's rebuilding the metabolism. It's improving metabolic flexibility. It's helping your body become more fat adapted. Meaning in times where you are in a caloric deficit, your body can oxidize and burn fat better. You always want that. Also, AOD, though, is not the cheapest peptide. And so that's my only caveat is financially, if you're trying to be as conservative as you possibly can, then you could totally wait on the AOD. It's not required during the reset, but it certainly can help with the process and potentially get your results even faster. So that one's more straightforward. GLP-1. So this is where obviously I can't give you guys the medical advice on stopping this or not, but I actually we were talking a little bit earlier about that. So what I was saying earlier applies to the situation. There's advantages to stopping your GLP-1 during the reset, and then there's potential advantages, and then there's potential cons. And truthfully, it's just a matter of your comfort level, making a decision based off of maybe where you recall you were at before the medication and where you're at now. It was easier in our example before because she was like, I didn't even notice the difference. And so it made sense for her to back down a little bit. But outside of that, if you guys have any specific questions regarding your case to help you make a decision, let me know. But is there any questions on GLP-1 AOD during the reset? Fantastic. Okay, cool. Oh,
Sorry.
yeah, yeah. Ask, fire away. This is for you guys.
So I'm just starting out. I haven't received the AOD or anything. I guess that's the reset is the long fast that we're starting, or no, it's not the long fast that we're
No,
starting.
not the long fast. So two things. The arrival of your medications is an independent timeline from the coaching, just so you guys know. The requirement for that was, if it's the GLP-1s, it was the lab results and the medical call. And then you get a text message when the order is after that placed with the pharmacy, and then that starts the timeline, week and a half, it arrives at your door, just for the timeline of the pharmacy. The reset is essentially the period where we're slowly increasing your calories over week by week to graduate you through that. Fasting is okay as far as just intermittent fasting during the reset, but the longer stages, it's actually important that you don't do anything beyond the intermittent fast during the reset. Because if you think about it, what we're trying to do for the reset is we're trying to tell your body, hey, I'm not starving. Food is plentiful. Speed things up, crank it up. So that when we start the program, start that portion of it, resets over. Now my metabolism's as fast as it possibly can be. And then we can get into the flow fasting. Does that make a little more sense?
More sense. Thank you.
Yeah, of course. Fantastic. Okay, great. So a lot of you guys are in a reset, mini reset. So like we said, intermittent fasting is okay, not a requirement. We graduate you, then you're going to be ready to go into the longer fasting. So there's 24-hour and there's 48. The goal is to get to the 48 as quickly or as slowly as you want, meaning in 1 week or 5 weeks. It's totally up to you. And those are arbitrary numbers. I've seen people take longer. So the GLP-1s, the AOD, obviously are helping your body to make this a lot easier. But your bodies, you guys have your own starting points, you have your own stress levels, you have your own current health status that we could potentially quantify as really good or really bad. And so because the variables are so widespread, it's going to be your choice. Again, I'm here to guide you as much, me and Ceci are here to guide you as much as we possibly can, so that you can make the best decision that makes the most amount of sense for you. Because I also like to think of the third category, which is just your own personality. Some people like to rip the Band-Aid off, and some people like to slowly pill it. So the choice is yours. The faster you move, the faster the results, which is awesome. But then the faster the stress you are putting to your body. And so the only time I would say maybe don't go super fast would be if you are under a lot of stress in your life, or if you do look at your overall health, you're diabetic, you have a bunch of autoimmune diseases, like your body's not in a great state of health, then maybe let's, even if mentally you're excited, let's dial it down a little bit. Let's give your body a little bit more time and see how it does as you're progressing. So the main takeaway with this is you are progressing yourself through the stages of fasting at your own comfort level, knowing where the goal is. The goal is to get to around 48 1 time per week. So any questions on that? This is really important, just that understanding of the progression through the stages of fasting. And obviously, if you have questions later on, we have those other weekly calls to answer more, but just that starting point. Do you guys have any questions on that?
I do. When you say to get to the 48 every week, so that's going to be the goal. Like every week, you should have a 48-hour window fasting.
Correct. That is the kind of cookie cutter template that we modify per individual if we need to.
Right.
But a lot of people do pretty dang good with 48. It's like a dinner to dinner kind of situation. So you're really just skipping one night's dinner and going from the dinner before to the dinner after. Just so it's not like you're skipping 2 full days. If you think about it, at dinner, which is usually the main meal, you're only really skipping one, but
Right.
it's a full 48. So that's a long time for your body to heal insulin resistance. Now, Tracy, in your case, your goal is much smaller. And so could you theoretically get away with a shorter window of fasting? Is your insulin resistance less than probably a lot of people here? Probably. Would the long fasting harm you? I think it'd be amazing for you regardless.
Yeah.
But yeah, so in your case, we could probably modify that a little bit. We'll see how your body does. But what we don't know, just because somebody is more overweight or less overweight, does not necessarily guarantee how metabolically deranged they are, how insulin resistant they are. And there really is no the fasting insulin test in the beginning, but what we're just trying to do is we're trying to make massive improvements, reduce insulin resistance, reduce inflammation, so that when you get to your goal, if you're on GLP-1s, you can wean off or get to a microdose and you live this new lifestyle. And if you guys read, the goal is not a long fast like this for the rest of your life, just to make the improvements in your health What I look at lifestyle in the future is, say, a 36-hour fast, maybe once a month, which is still a lot more aggressive than you hear from other people. But I think it's why I have so many people maintaining a healthy weight that never have been able to before, because I'm asking them to do one 48-hour fast once a month, give or take. So does that answer your question?
Yes.
Fantastic. Any other progression of fasting questions? Fantastic. Okay. So when you're not fasting, you're eating. And the title of my book, Fast, Feast, and Flourish, that name means a lot. When you do this kind of level of fasting, it's like a feast. Even in a weight loss program, there still needs to be, if you're always fasting and then under eating, that doesn't work. And that means you're just not eating enough calories and you will get into a plateau. So for the rest of your life, I'm creating this concept of having fasts and having some feasts. They don't need to be a crazy intense feast by any means, but just some sort of cyclic nature in your intake, which is nice because guess what? Life ebbs and flows. And so it's so nice to have a life where you could just eat more because the social event called for it. And then the next day, you could just let your body say, hey, I'm not that hungry, and just eat less. This is actually good for you. And I'm just bringing your body back to that point where we can get you there, but we got to fix some of these underlying issues. So what are we eating? Just wanted to give you that little sort of caveat to the nature of the contrast. Nothing magical. We're just eating less processed foods. So I call it the anti-processed food diet. Paleo Mediterranean are great examples of what we are shooting for within this anti-processed. 90-10 is what I ask for most people to adhere to. Again, it's a generic kind of range, but essentially I want you to have some wiggle room. I want you to have some junk food. I find that if you tell yourself, hey, I'm going to have a meal that I'm looking forward to on the weekend, then great, we can do that. And it gives you a goal during the week. Obviously, the GLP-1 makes it easier to adhere to a 90-10 rule. And the only modification we're going to do is keto. Keto for that first 2 to 4 month period, maybe a little bit sooner, maybe a little bit longer, depending on your individual goals. We'll tailor that with you individually as things progress. And then breaking your fast is its own deal, as you saw, starting off with easier to digest food and progressing into essentially normal eating. So a full 24-hour to break your 48-hour fast is what you should anticipate for the first couple of weeks. And then your body does get better at long fasting. It takes time, but your body adapts to long fasting, like your body can adapt to everything. And then the protein, super easy formula, current body weight, target body weight. So if you weigh 200, you should weigh roughly around 150. You should be striving for about 150 to 200 grams of protein a day. So if you just have no confidence that you're getting that level of protein, because I don't want you guys counting macros, generally speaking, that's a real pain in the butt. Counting protein for a couple weeks is nice, like the calorie counting experiment. You learn calories for the consciousness that you have in the future. Counting protein could be nice because then you're like, okay, I know what 200 grams or 150 looks like throughout the day. Then that would be a good use of your time to develop and learn that skill. Any food or fasting questions?
I do.
Oh,
Go ahead.
sorry. Just a quick question about AOD. Can I take that at any time, or does it have to be in a fasted state?
Most people will recommend fasted just to play it safe because even though it's not a growth hormone peptide, we know that you have to do that as growth hormone peptide. So it's always been advised to do that. So I would recommend doing that because I think that's the way it works, which is funny. We have never really tested that out yet. So morning when you wake up is a good time. You got the troche, you park it there in between your teeth and your gum and just forget about it. Let it dissolve. Cool. You could do before bed too as well.
Ask about, I think I heard you say sometimes we focus too much on the protein and we're not getting the healthy fats. So on the keto diet, which I usually live by, but I probably don't do as many fats as I should. So when you're doing the keto, and I need to review, that's the one thing I haven't reviewed on your program because I thought I knew it pretty well, but maybe I don't. You should be having a fat with your protein every time you're eating.
It's not like the cardinal rule isn't that you have to have fat for it to work, but by definition, you're not doing keto if you're not having fat every meal because, again, you only have 3 sources of calories. And if you cut, the target for you guys, I did skip, so let's mention that really quickly. 50 grams would be a nice target of net carbs. So total carbs minus fiber, if you want to count it and give it an idea so that you know what you're shooting for, about 50 or less. So that means the rest of your calories, you're only going to have so much protein. So you're literally only left for fat. So it is a bit of an adaptation, if you will, to choose things that have fat. Like you got to get comfortable with that, because if you're not choosing fat and you're not eating carbs, then that means by definition, you're not eating enough calories. Or you think you're not getting carbs, but you are. So something's off there. And when you look at the healthy fat choices, it's okay to have some saturated, guys, but nobody's under eating saturated unless you are really strict vegan. Maybe that would be an exception, but all your animal fats, all your dairy, all your delicious fatty sources are saturated. The areas that you will have to put attention on are getting the unsaturated sources, which is not a long list. I can literally go down the list right now. This is your Mediterranean foods, by the way. This is why I love Mediterranean diet. Olives, avocados, olive oil, avocado oil, small fish, and nuts. That's literally it. So it's not a large list of foods, but those foods are so good for you. And so you really want to get comfortable in Mediterranean, searching the menus, and then the only modification is just going a little bit lower on the carb for the first period of time. So fantastic. Okay, cool.
If you guys enjoyed watching this video, then you guys are going to want to check this one out. I take a deep dive into fasting and overall lasting weight loss strategies utilizing these GLP-1 medications in the best format, microdosing, intermittent usage. Check that out, guys. We'll see you later.